Hello, Michelle, and welcome to the Into the Woods podcast, my queen. How are you?
I'm great. How are you guys?
Doing
It's
well.
been quite a morning. It's awesome.
Yeah.
Always quite a morning. There's never a dull moment.
Quite a morning.
Offline, we were talking about how cray-cray today has been. Thank you, Saturn retrograde. Thank you, the shadow side of Mercury retrograde.
And the full moon that's today.
The full moon in Aquarius today. It's been, Michelle, aren't you in Aquarius?
I am. This is my full moon. Who knew?
It's going to feel big. It's going to feel big.
You know, this episode of the Wayfinders, as we are here again, and I have been mentioning this for those that haven't listened to the previous episode, I created this segment for the Into the Woods podcast, the Wayfinders, to give back to all the women in my life who've helped me find my way. And it made the most sense to have you on here. But this is a little bit different because you are not one of my spiritual healers like the other girlies we've had on here. You have physically healed me as a pelvic floor PT doc. I went to a little class with you and your colleagues at my gym. Half of us were postpartum, half of us were pregnant. I was postpartum, and you kind of opened the floor for any questions. And I raised my hand and said, I would like to stop peeing myself. And you said, we can fix that. And you did pretty much within 1 to 2 sessions. And so we'll obviously get into that today, but for everybody listening, today is about physical health, and I'd love to know about your spiritual journey too, as you've hung out with me and Kara and gotten more into the wood and less into the analytics, even though you're an analytical girly. But yeah, that was just kind of the intro I wanted to push out for everybody.
And listeners, just know that all of our pants are dry during this interview.
Yes.
Thanks, Michelle.
Very
Oh my God,
important.
thank you. Thank you guys. What an amazing intro. I just need you guys to follow me around and just say that everywhere I go. I feel amazing.
We could definitely do that.
Yeah,
I'll just carry a tip bucket.
I mean, I don't have to pee in the middle of the night. I can laugh just comfortably.
Great.
Details. I mean, just amazing. I'm seeing one of your docs today so she can dry needle the shit out of my back, which I always need because I do this. If this keeps slouching, it's never... It's
not hunchy forward, gremlin
hunchback.
Posture.
Yeah. And, I should stretch and stuff, but I don't. I just come and get dry needled, and I have you guys stretch me out once a month. So,
perfect.
Yeah.
Maintenance. What it's all about. Physical maintenance.
Exactly. Well, Michelle, I'd love for you to introduce yourself and your amazing business, Pillar Pelvic Health. Give us an intro, give us your background, all the things.
Sure. So I'm Dr. Michelle Koval. I'm the owner of Pillar Pelvic Health and Physical Therapy. It's a brick and mortar practice in Cincinnati, Ohio. There are 7 clinicians here, with myself included, and actually have not been a pelvic PT my entire career. I've been a PT for 17 years. My initial startup was actually in the hospital system. I worked in acute care, ICU, and trauma therapy. I did when people had everything broken, I was the person who started getting them moving around a little bit. Went to long-term acute care because my husband's job moved around a little bit. Inpatient rehab with outpatient ortho, and then outpatient ortho with pelvic health experience here in Cincinnati is where my initial journey started in one of the major hospital systems here. I had a really crummy postpartum experience with my first, tons of postpartum depression and anxiety that was undiagnosed. But medical care provider just wasn't attuned to it. Again, it's been 11 years at this point. So, I think a lot's changed in that time, which is really helpful. So I was moving my body way too soon, way too aggressively. And I gave myself a pretty gnarly vaginal prolapse because I was looked down. And I was like, oh, that is my insides. They are outside my body. That's wrong. And I freaked out as anyone would. And I called my OB at the time. And she just kind of said oh, it's fine. Take a rest day and we'll have surgery when you're done having kids. And I didn't like that answer. So I called my girlfriend who I knew did pelvic health, and she's a physical therapist as well. And I said, hey, Liz, what in the world? One, what is this? I will send you a picture if I need to. And she said, you can if you want, but I don't think I need one. It just kind of helped me to kind of calm myself down, realize that this is stuff that we do on an everyday basis, and gave me some tips and tricks, some people to start following, some courses to take. So I started taking my external courses to kind of help rehab myself in that moment. I did some online therapy at that point, and I just it was fine, but it didn't hit the head as much as I needed it to. And then I did internal coursework, and that's why I really felt my passion for pelvic health really thrive and shine. I established a program here in Cincinnati at one of the major hospital systems, was poached by another one because they said, hey, I love what you did there. And now I was just kind of done with the red tape and not being able to treat the person like I wanted to treat them. When you're in that hospital system, you have to go by a diagnosis code. That's just how insurance companies work, which is like great for some things, but also really unfortunate for literally everything in pelvic health because nothing is really covered, which is kind of a bummer.
Just
There
crazy.
are like, I know you can kind of get around it a little bit, but if you want to treat the whole person, which is our big passion here, is making sure we get to the root cause of what's going on with you, treating you from head to toe and making sure we really see you as an individual and what your goals are and how your whole body goes, because that impacts the mainstay of what your pelvis is doing. And that is where the muscles are inside the body that help to keep you continent and help you to have sex and reproduce and all those things. So I opened Pillar in 2022, met Rachael. Honestly, it was pretty soon after that because it was like 23 or 24.
Yeah.
I did the workshop and I remember like clear as friggin' day. Like we like do the whole thing. We get to the end. Like, what other questions do we have? And Rachel like
First one.
like, I'm like, I got it. I don't want to be myself anymore. And I was like, got you, boo. Come on in. And I'm so glad I was able to help you and so many others. And we're just really excited to continue the work and the journey that we're doing here. A big passion of mine is making sure that there's balance in the system, that we're not burning therapists out. You can get really like churn and burn options. Like we make sure that there's enough rest with play and work hard, play hard mentality here. So that's kind of what we do, because happy PTs make for better clinicians, and that makes for just better outcomes for patients.
Everybody in your office is so awesome. You invited me, which was so amazing, to do a group numerology reading at your office where I did personality profiles and yearly and monthly forecast reports for you and 7 of your employees. And so a mix of like admin staff as well as other PT docs. And then we sat down and went over my executive summary that showcased how everybody fits into these different titles, let's call it, as far as how they lead, how they communicate, how they do tasks around the office, and how you could best maximize everybody's talents. And in my discovery of looking through all of this stuff, like, you have such an amazing office of women who are so inspiring and so empowering and just, amazing people. And that has to feel so good. And I know you've been expanding to just have found such a great group of women to work with.
Yours and Kara's guidance with all of this has been amazing. Again, like you said, I'm a very analytical person. I have not been into the woo as much. And when I started, I think that's what initially like sparked my interest in expanding outside of the traditional science and evidence-based practice. Like, 'cause yes, we want things evidence-based and we obviously do that first and foremost, but sometimes you have to have the anecdotal and like this, the gut instinct, because those are the best clinicians, right? Those are the people who So like one of the obstetricians that we work really closely with, like I think is a part of this. Like, I think she really is like part of a witch because she has this like innate sixth sense that picks up on things that nobody else would have ever known. And it's insane. And so I've been able to kind of use obviously your guys' guidance to kind of help me get into things a little bit more. And going through the reports, Rach, like it was crazy how almost everyone, with the exception of like 1 or 2 like different facets, were already in the roles that they were destined for, or that they were like designed, if you will, for. Like our front desk person, like she was in like the exact role she needed to be in at this point in time, where she was able to kind of do the personality as well as the analytics and like pushing forward. I was like, dang, like that is some intervention happening that is, or maybe I'm able to read a room pretty good. Hopefully it's a little combo of both. But yeah, it was so eye-opening. And I mean, I'm so thankful to have had that happen. And I know everyone at our office was blown away, because it's not like you get a little, like you're an Enneagram 8 and here's what that means. Here's literally like even how you like poop, right? Not really, but kind of. It's like 45 pages. It was insane. So cool. And everyone is going back and being like, oh my gosh, yes. Oh my gosh, yes. So like it shows that it friggin' works. And like we're all tied together.
Yeah. And obviously, your business is so successful because it's easy to go to any doctor's office, but it's really something when people can get the whole person. They can get a little bit more of that intuition. You've got your science-based stuff that's showing proof that it works, right? In all these cases, but to have that extra like whole person looking at all the different facets of it, I really think that's what makes it the best, because I've heard just the best things about, even from people who don't even know that I know you, and they'll talk about you. And I'm like, I know her. She's amazing. But also another thing about the spirituality. So, you're dealing a little bit more with the physical plane, but that's so important because we have to have that safe place to anchor us, right? Like for the spiritual all to ground in, we need to be like that vessel that's prepared for it, that's ready for it. And I mean, if you think of the womb as a vessel and the women's body as a vessel, that's exactly what you're doing. So you are working on the spiritual plane just in a physical way. And I think that's a really important thing that a lot of people don't realize.
I agree. And there's so many emotions that are trapped inside the body, especially in the pelvis and the hips and the belly and the gut. Like we work on those, and I cannot tell you the amount of times people just start crying and they're like, I don't know what I'm doing. I'm like, girl, like you're far, like whoever, like you got it. Like just let it out. Like whatever is happening, like your body has just been trapped and holding on to this for a little bit. So like, let's work it out. Let all the tears happen. There's always tears in pelvic health, and we're here for it.
Yeah.
Yeah,
As long as it doesn't hurt your leg.
right. That's what's so important about the work that you do is when you don't feel good, forget about the mind, forget about the spirit. If you can't function normally on a day-to-day basis, you're just going to be trapped in that state of affairs. So once you get your physical health in check and get that confidence back that has been inhibited in some way because of some trauma your body has experienced, then you can actually start the work of, okay, now I can actually go to a yoga class and maybe I might be able to shut my brain off. But like you said, even in the work that you do and releasing so much, it's not just physically, but also just all that pent up emotion and trauma that's tied to what you're working on that, I mean, probably most women, first of all, giving birth is the craziest experience. Like the entire
and it's a trauma in itself, right? Like
it
it's
is
a beautiful
trauma.
thing, but
Totally.
your body sees it as a trauma because it's losing something that it's been harboring
Totally.
for a really long time. And it's a very aggressive experience.
Yep. And then the after, like, I still am blown away. Once you have this baby, you're kicked out in 48 hours and they're like, good luck. And I remember after having Sophia, my first, of asking the nurses as they were coming in when they were going to bring in the CPR training, the choking training. I was like, so if my kid is having an issue, and they were like, no, honey, we're going to teach you how to breastfeed. And you just need to have bowel movements while you're here, and then you're leaving. And I'm like,
Truth.
literally, that's it. So, and then after that, it's like, cool. So then for 6 weeks, your body's supposed to heal in a way that you've never experienced, and things may be falling out. And then your big concern is watching for clots. And you're like, I don't love that. You're wearing a diaper for a while, and then you're supposed to oftentimes just fucking go back to work after 3 months and be like, YOLO. And then you just got all this other shit. And then we're told, like, our moms are still peeing themselves.
Still. And hemorrhoids.
Literally my own mom. And she was like, I can do something about them. Like, Terry.
My mom started seeing a PT doc 1 month before me, and I was the one that was fucking very closely postpartum. And I was like, hello, lady. Do you want to maybe mention what you're doing? She's like, well, it was my first appointment. And I'm like, I don't care. I just had my second baby. Mother, I don't get it. But they do now. They will now when they listen to this.
Yeah, that's right.
And this is becoming much more common space too for people to then treat it, not just say, this is how it is. Sorry, you had a baby and now you're just doomed for this for the rest of your life. No, we can do something about it. And that's what we're doing.
Shout it louder.
Yeah, a lot of what in the spiritual work, which I think does correspond with the work that you do, is when you realize that everything is energy and that we are truly just souls living a human experience. So much of what we experience and who we are is a result of obviously things that have happened to us. So to get back to like our soul level self, it's about remembering that person and releasing what isn't serving us anymore. And that to me is literally exactly what you guys do in your practice is we're releasing all this stuff, this traumatic stuff that our bodies went through in whatever circumstance it went through, and just getting back to where we were and an improved, it's always good to level up version of ourselves. So essentially the work you do is no different from the woo. That's basically what I wanted to say on this episode.
Yeah.
Cool. Everyone. No, I
Yeah.
think so. It's so true. And what I think some people get hung up on is the word trauma, because trauma, it can be the big T trauma, like the sexual assaults, the car accidents, the birth, whatever. But there's also little T traumas that happen throughout the day and throughout your life. And like your body hangs on to all of those too. And those can accumulate over time. And sometimes what we perceive as something that's like fine is actually like nefarious in our brain. So we want to make sure that we have everything on the same even playing field. So there's so much emotion that's tied into, especially pain in our body and tension. So that's why we really don't ever discharge people here, which is, again, something that's unique about our practice is we call it like a ta-ta for now. Like, we'll see you when we see you again, because we know, right? Like, your body's going to continue to move and groove and have these experiences. We want you to always feel like we can be your plan A, right? Not like the backup plan, but like, hey girl, like my knee just got messed up. Like, what's going on? Like, okay, come on in. Let's see what's going on.
About that maintenance. Yeah, you need that continuing maintenance. It's not just like, here's 3 weeks and now you're good. Our bodies are ever evolving, and we're going to get more trauma along the way, but we're going to heal along the way. And I'm sure that you see more of that. Like people come in for something specific, but then later they'll have something, and the healing might be quicker later because they're learning how their body needs to adapt through what you're doing.
Yes, every time. And it's crazy because we see the whole gender spectrum here. So we see everybody, like truly anyone with the pelvis is like our big thing. But like we'll see guys in particular, we'll get them through whatever it is that they're having, whether it's ED, pelvic pain, constipation, which usually it's like the trifecta of all of those. And then they come back for a back issue, and like the back issues resolved within a session or two because they have all that groundwork that they've been working on before. Or women have their second baby and we saw them with their first, or they have their third baby and we saw them with their second. And like the recovery process is so much easier, so much better because we put the dang work in. And that's not on us. It's 100% on the patient and how they uptake that information and how their body gains more confidence with moving too.
Mm-hmm.
Yeah.
And I've noticed how important it is to have maintenance. Like, that's why I'm going to be a forever patient, because I can see the value of coming in once a month. For me, that's good. When I was first seeing you guys, it was probably every week, maybe every 2 weeks. And obviously every plan is different depending on what you're dealing with and how frequently, I'm sure you have people initially that are coming in maybe even more frequently than that. But maintenance is it's so important because, like you said, the more you keep up with something, the more your body remembers. And then, like you said, when something comes up, and even if it's something very different from what you had originally treated, because your pelvis affects everything that's going on, that once your body remembers what it's supposed to do, even if you have to come in for a little tweak or a different exercise or whatever it may be, that's going to help with the new specific issue. If you've been keeping up with it and doing the work behind the scenes, but maybe also coming in for that maintenance, it makes a huge difference. I think about my chiropractor. I have been seeing him. It was probably 2 months before I got pregnant with Sophia, and she turned 3 in May. Okay, so 3.5 years. And I have been seeing him every 2 weeks for 3.5 years. I have no back pain. I used to have lower back pain that was so bad that at the end of every day, I could not do the dishes because my back would be throbbing. The amount of icy hot I used in my life, like Bengay, I carried in my purse like hot sauce or something, I mean, it was crazy, like the pain. And then now the maintenance, if I don't see him for a month, then yeah, it's a problem. But it's just amazing how important that stuff is, that and I love that we're bringing up how your practice operates of, yes, we're here to help you with a present issue, but it's also like so many of your patients come in for their regular maintenance, however frequent that needs to be.
Yep. Yeah. It's great. And it's something, again, like, it's why we're different, right? Because especially from like an insurance-based model, like you're not going to be able to do that. You have 6, maybe 8 visits if you really push hard enough. And then after that, it's like, deuces, best of luck. Where here, it's like, we'll do whatever cadence you need, right? What do we recommend? What can you actually do? Like, what is your bandwidth And then we figure it out from there.
Yeah. No, you guys have changed my life. So you've definitely, it's such like, some of this stuff is major, but it's also just like an annoyance or, something that you can like live with, I guess, but it's like until you're on the other side of it and you're like, why would I torture myself even in a small way when I can have everything? It doesn't make any sense. I don't want that.
That for
Yeah, exactly. So what are you seeing that in your practice people are looking for right now? Part of the Wayfinders is people are feeling lost. They're trying to find their way. And to your point, pelvic health has blown up. Way more people know that it exists and it's so, so important. And, what are you seeing that people are needing? How has it developed? Kind of give a little insight on if someone's listening and they're like, oh my God, yes, this is what I need.
Yeah. So I'm going into my 11th year as just strictly a pelvic health therapist, which is crazy to think about. But I think a lot of people, they're looking for different things right now. I think from a gender spectrum, because I feel like there's different things that men are currently looking for. So bio men versus bio female. So men are looking for, the ability to move more confidently in their body, but also just like pain relief and lasting results. Women, I think because perimenopause and hormonal changes that are happening in the body have also blown up, especially in the last like 2 years or so, they are now like, okay, well now what? They want more information and how to, like, what's happening in my body. Does that make sense? Because what we were told forever, that's what I was told. That's literally what I was told. It was like, this is just how your body is. Sorry about it, sis. Best of luck later. And what we're finding out now through like tons of research and obviously anecdotal stuff, but like tons and tons of research that are supportive of, those perimenopause symptoms, they can be reduced by movement, right? So if you lift heavy 3 days a week, your perimenopause symptoms, hot flash, brain fog, all the things are reduced by at least 50%, if not more.
Really?
Wow.
And if you are someone who is like not okay with hormone therapy for whatever the reason might be, your tissue changes vaginally and you can actually put a dilator in or a dildo, truly like something that vibrates. You put it in your vagina that is circumferential. So again, kind of like a dilly. And you turn it on for 10 minutes, 5 days a week. It has the same exact effect of vaginal estrogen.
What?
Right?
Can
Is
you
that why you
text
guys have
us
all
this
these
later
dildos
just
in
so
your
make sure we have this? Just
Yes. And like hydration from 38 years old on in the vagina is not an option. It is a necessity. You have to hydrate your vag because your estrogen starts to go down at the age of 38, which is why you become in that advanced maternal age at 35 because like eggs are getting a little bit like a little crusty, rusty in there. And all these things happen because of a hormonal shift that is just biological in nature. We can't do anything about it. We can get on hormone placements and all the things, and that'll definitely help, but their body's going to continue in this like downward trend because we want it to. We want to get to the end of that. Like, girl, I don't want any periods anymore. Like, seems fine to me. But just like that ramp up was really crummy, the ramp down is also super shitty too. And we forget because it's been so long, like really painful when we're younger and how like it was spotty and all over the place and we were hormonal and ragey and like we literally just flipped the script when we're older now. So we have like no filter. We have no patience. We usually have some other dum-dum who's around us telling us like, it's probably you mean hormonal. Like, maybe. Do about it from a physical, non-hormonal thing if you want to. And if you want to go the hormonal route, hell yeah, like do what's best for you. And we'll help guide the process too, because if we're not getting somewhere with what we're doing, we have the people in our court to be like, hey, you can go see XYZ. Who's closest to you and who do you like best?
Yeah. And people want options. They want options. People are picky these days. We have unlimited information and different choices. And so that's really important for people. But it sounds like you're the best starting point for all the things and all the avenues that people can try when they're having any issues in that area.
Right? Because the person that you want like in your core is somebody, you want the coach, right? You want somebody who can be like, I want these plays to happen. And if you try to do that on your own, you're going to get somewhere, but gosh, can we get you there quicker?
Right. Because we just don't know. I mean, women just are never taught this. It hasn't been talked about until recently. So I'm glad it's becoming such a hot topic.
And I think that's the other thing is like, because there's, like you said, there's so much information out there. What is actually true? What is evidence-based? What is the thing that's actually going to work for me in my moment? Not that's going to work for Sally over here, you know?
Exactly. That tailored to you approach is,
Mhm.
yeah, everyone's
Because maybe you do
different.
just need to like lift and put a dildo in and add some vaginal hydration, or maybe you actually need to go on like the full gamut. Who's to know? But we can again help that process a little bit too, just from like educating and like understanding where is the body at right now.
Absolutely.
I think it's important to note that you are constantly making sure yourself and your other PTs are up to date on the latest. So we were talking about earlier when I was in there for the numerology reading and you guys were over there learning about like buttholes or something. I don't know what you guys were doing. Like I
Balloon
am looking
expulsion set. It was
yeah,
amazing.
I'm looking forward to titling this something crazy. Like Michelle's advice is everybody needs a dildo.
Yeah, true. In so many ways.
So you guys obviously because like the facts you've already given us in this episode, I'm like, what? Like I've never even and I'm not in
No.
the medical field, so I'm obviously ignorant to most things in the medical field. But there's so many practices, and it's not just medical, it's any practice where the practitioner gets older and they stop learning and caring. They get stuck in their ways. And especially in this type of medicine, like, oh my God, I hope you're up to date on what's going on. So it's important, I think to note how constant it is for you and your employees to be up to date on their own, learning on the side. Obviously, most of you guys have a lot of certifications. I mean, you have quite a lot of letters behind your name, ma'am. And, that you're also doing this in a group setting so that everybody in the office is aware and you're implementing strategies and stuff as a team so that everybody's on the same page, that you guys are keeping up to date with the latest.
And it's
so
more than
every
just
week
Kegels. More than
it is
just
so much
Kegels.
more than just Kegels. But no, every week we actually get together on Tuesdays. We have lunch together. We call it our lunch and learn. And that's where Rach came in. And we have a 2-hour deep dive once a month where we actually are really going into doing like manual hands-on training or whatever. But the one we did just yesterday was how the shoulder impacts your pelvic floor and what happens from the scapular mechanics and the rib cage mobility and how those two things aren't working from a shoulder component, like what actually happens down below. And because that can impact prolapse, diastasis, urinary leakage, rectal tension, constipation, abdominal pain, lack of ability to use your abdominals. Like again, the shoulder and the pelvis are really the whole thing's connected, and it's being able to have that. Here's what I know, and then have that like ping pong back and forth with the other clinicians because they are amazing and know things too, especially like the ones who've worked in orthopedics, the one who's been in pelvic health for the longest. Like now we can kind of saw back and forth to see like what could a good treatment plan look like? What are the exercises you like for this? Because that's again what the group model here is, which is awesome. We get to have 7 people talking about the same thing in 7 different ways, but all for the same result.
Yeah.
That's incredible. Incredible, really. I love
Yeah.
that. I really would love to sit in on some of those briefs, like be a fly on the wall for that,
Yeah, come on over. Come on over. The one that Rachael was here for, she did not get to experience, but there's a balloon expulsion test which help you with getting your stool outside of your body. So it's a defecation test. And so it's like, here are the balloons. We're going to put in your butthole. We're going to inflate it.
Sign us
And how do
up.
you explain it? 'Cause you're expecting for like a patient to do this. So if you don't know how to do it, because you can set the test up or whatever, but if you don't know how to cue it, if you don't know what it feels like, then you don't know what the patient's going through. So then how can you relate?
Absolutely. No, that's so true.
Before we close up, there's a couple more things I wanted to address. So if someone is per se feeling lost in the woods, what would you want them to know?
They're like, are they lost in the woods about their body, I'm assuming, or about like life? Because I feel like if it's life, you need to go to you.
You can answer this however you want.
Get your tarot read and get your oracles in check.
Lean
if it's
into
if
what
you're
you
feeling-
know. I would lean into what you
Okay,
know.
perfect. So, but if someone is feeling lost in the what's about all the information that's out there about their pelvis and how their body's aging, or you're not really sure what's going on, is just to have someone be in your corner to help guide you a little bit more, right? So you guys talk about spirit guides a lot and how they're there to guide you. Well, we need a physical guide too, in my opinion, and that's where we can step in. We are movement specialists. We are neuroeducation specialists. So we can be that person for those who are in need, and we are for so many. And it's such a privilege to be able to do that. So if you are lost in the woods, we can be your guide.
And I know the list is probably huge, but what are some of the things that you can provide? So obviously people come in, you're doing different kinds of checks, and you're physical therapist, so you're giving people exercises that they can work on. But like, I didn't know you guys did dry needling. That has been a game changer. So maybe can you list out like, hey, these are some of the things we can provide. And if you're seeing like 10 different people for this, maybe you could just come to us and we could provide all of these things. Or maybe you still need to go here, but at least you are knowledgeable about what we can provide for you.
Yeah. So things that we provide from like a manual basis. So we have the dry needling, we do cupping, we do kinesiotaping, or leukotyping, just things to kind of help stabilize or inhibit or to promote different like muscular activation and movement patterns. We do a lot of fitting for belts for pregnancy. So the sacral joint belts or any sort of perineal support in the postpartum. We are able to fit you for those to actually tell you what your true size is versus like, I don't know, medium. An exercise component, we can help guide you through what is actually appropriate for your body. We can create an exercise program for you. We can work with, if you have a personal trainer, different cues and things that your body needs to make sure that you're hitting the right thing appropriately. There are some amazing person there, but you just need like different cues in your brain that tell you like what I'm supposed to be feeling. And they might say it, but we might see it differently, and also focus on the root cause of what the actual problem or weakness might be. We again are good like health coaches. We can help kind of guide things, not so much from a nutritional standpoint, that's a little bit outside of our scope of practice. One of our clinicians here does actually have a nutrition background, so she's that person for us. But we can do the basics of like, this is how much fiber, this is how much protein, this is how much water, this is what the macro should look like. And then we can hand off to, again, like a nutritionist to help you with a meal plan guiding or what have you. Not saying that we can substitute by any means. That is, again, outside of our scope, but we can definitely help guide that process. We have what's called point of care ultrasound here. So we're the only ones in Cincinnati right now that have it. So essentially it gives us a look at what's happening on the inside of your body. So if you think about the ultrasound for what you had when you had kind of looking at the fetus and fetal development. We actually have a very similar ultrasound that we use with an iPad. So you can actually see your pelvic floor and what it's doing with breathing, with movement. We can see how your bladder is, if it's retaining any moisture or water or anything, there's anything happening from that component. If it's connected, you can actually use it on your abdominal wall or your shoulder or your hip, and to actually see the muscles move around a little bit too, which is pretty cool. And it's a really good visual feedback for a lot of people who just don't understand or have that interoception in their body or that awareness in their body to kind of figure out what the heck am I actually doing. And then we're great for just maintaining overall global strength. We obviously work with pain with sex and erectile dysfunction, any sexual intimacy issues. We have done partners before, not in the room, but can be like side by side. So kind of talk about that. Or if they do have a session together, it's more of like informational, like this hurts, this doesn't, this helps, this doesn't.
Yeah.
Work on painful periods and constipation and fecal leakage, both ends of that spectrum. Urinary incontinence obviously is like a big bread and butter that we have. Abdominal discoordination pain, abdominal phrenic dyssynergia, which is where the body just isn't hitting things together. So again, that list is really long. But yeah, if you have any of those things or anything sounds like it's triggering or ringing a bell for you, then might as well at least call. Right?
Yeah.
Like, hey, is this something you deal with? And the answer is almost exclusively yes.
And they're all linked together too. So you can have a couple of these things that link. And if you can just kind of get that kink out, a lot of those other things end up flowing much better. And I think that's probably the most special thing that you do, really. I mean, when you think about all of it, how we can just get in there and fix this thing, and then so much else can flow better for you.
Absolutely. That is, I think, the biggest take home, if any, you've taken nothing out of this podcast today, is everything is connected and it's all linked. And we can figure out where the kink in that link might be.
I appreciate you listing out all the things that you provide, because some of it I was oblivious to because I don't personally need it as a patient, but I know the breadth of your practice, and I just want to make sure people are aware of, especially since pelvic floor healing isn't as mainstream as like seeing a pediatrician, things that like have existed forever. But when you were talking about even just if you had a personal trainer and how you're supposed to move, one of my sessions at some point was one of the PT docs was asking me to just take a squat or like do a lunge. And I was doing it completely fucking wrong. Like, athlete, my whole life, played soccer competitively, played lacrosse, was a dancer. And I'm standing there and she's like, no. Of course, she didn't say it like that. She might have, because everyone in your office is so cool. Like, if you want to go to a cool doctor's, like, you need to go to Pillar Pelvic Health, because there the F word is encouraged. It's such a fun place, and also a place of healing. But I just was like, well, I didn't realize I was doing a lunge completely wrong. And it was so awkward at 32 years old to like be learning how to squat and lunge for the first time. Really, it felt like in my life. But it was a game changer. It was like, and just how you're supposed to hold your under part of you like properly, so that again, like I was trying to not pee myself while taking a lunge, which was not happening. And it's just little stuff. I just want to mention that because it's little stuff like that like you don't realize how important it is to like just even such a small thing like that, to be able to go to a training session and actually do it correctly, because you guys know how every part of the body works, so that again, like Kara said, it's all connected and you fix this little thing, or it's like the maintenance. Oh, we helped you stop peeing yourself, but you're lunging wrong and now you're peeing yourself again. Well, that's because you have to still maintain the same thing you're supposed to do even in that moment.
Yeah. And a lot of it is, we don't, and you mentioned like exercise that we get from like a home program, and we really do. We can do that really easily, where it's like the course and stuff that we use for like patients to be able to access. But a lot of it is those little things, right? So it's doing this pelvic hold, or doing this proper breathing technique, or lunging or squatting using these forms. It's things you're already doing. We just turn the dial, but not so we look at it from a different lens versus it being like squat 100 times. Because if you squat 100 times with crappy form, you're just reinforcing crummy movement patterns that makes your pelvic floor want to shit the bed, literally.
Yeah. You've humbled the shit out of me at seeing you. Yeah. I was like, I'm an athlete. It's like answering the questions like, oh yeah, I played competitive, and you're like, yeah, but you're doing it wrong. So let's start over. You're nothing you say you are. Take it back. Oh God. Yeah, that's pretty much how I talk too.
I don't have a good like poker face when it comes to when people are doing stuff wrong, because I do this. Yeah. They're like, what did I do wrong? I'm like, where do you want to start? But I'm in the same way. Like my own left leg like doesn't do the shit it's supposed to, because our brain's not meant to do that. We're supposed to like get to the end, not think about the process. And so when we think about the process, we can actually get it to do and move. And that's what we try to do, is get those better the patterns and strategies. And then we can go back into like, I just get it done phase.
Yeah. No, it's amazing all that you guys offer. You've helped me in the year probably I've been seeing you guys, and I look forward every month to coming back and getting my little assessment and checking in with the girls. And now that I'm, famous at your office, I look forward to everybody calling me by my first name when I walk in. Hey,
what up, bitch?
Hey, goddess. Details. Because you guys would do that, That's the vibe.
100%. Yeah, 1,000%.
I like to end every episode, because unless there's anything else that you want to say.
No, I think we crushed a ton of it.
I think we crushed it. It's so easy to talk to you and be ourselves, because we're both complete lunatics in real life.
IRL for sure.
Yeah, like also for anyone listening, you absolutely have to follow Pillar's social media accounts, because it is absolutely unhinged. It is so hilarious and awesome. Not only is it educational, but it's so entertaining, because Michelle is the entertainer of the year.
Unhinged, I think, is the right word.
Yeah, unhinged, but it's so perfect for what your practice is of like, we talk about dildos and we have to do internal exams, and like, welcome to the practice. This is what we're doing. I don't know what you thought this was going to be, but get on the table and take your pants off. It's like
with consent.
Yeah, with consent. Yeah, right. Yeah, this isn't like some weird like spa where it's like happy endings. There are happy endings, just different.
Right. Happy endings so that you don't pee your pants and you don't poop your pants, and you can have great sex with your partner.
Yeah, you can have happy endings by yourself at your house. And we'll just suggest, as the title of this episode, like, you need to get a vibrating dildo, that'll solve all your problems if you're over the age of 38, which I'm rapidly approaching. So I'll have to let my husband know.
What's funny is that that research study had the highest amount of participants who did not fall off the bandwagon, ever.
It's awesome. Science. Sweet, sweet science. That's hilarious.
Sweet science.
So to wrap it up, because you're a busy gal, you got a whole practice to run. You've got 10 employees. You just slay. I'm over here, party of one. That's okay. We're getting there. You inspire me. You're my CEO, boss bitch, inspiration. That's another episode. That's another segment. The boss bitches of Cincinnati. We'll get to that.
Let's get it.
Mm-hmm.
I would listen.
Yeah. I mean, I'll start thinking of who to add, but you can be my first one, obviously. You're probably on the biggest business of all my friends, so you should be the first one.
Cool.
Yeah, you're kind of a big deal. So, but I guess I don't have very many boss bitch friends either.
He's also party of one.
Yeah, I'm just just Michelle, please. Not to downgrade your success, but it's not like I'm talking to the CEO.
No, I like it.
Where it's fine. It's fine. I like intimate. I'm an intimate girly. I'm a one-on-one kind of girl. Don't complicate it. Keep it simple. Vibes. Okay, so I ask all of my participants, my Wayfinders, this sentence that I will ask you to complete. I know I'm finding my way when.
Feel complete. Because my role for when I got into this, what inspired me and what keeps continuing to go on is being able to not only the clinical role, I love treating patients is my passion, bar none, but being able to then influence those around me to continue to have that like-minded set. Because if we continue to have that, then the field changes.
Yeah. Perfect. I love it. You've made me feel complete. You've made me feel stronger and capable. And really, I think my journey into my health really started at your office of just being in this postpartum state after my second with postpartum anxiety, having all of these physical issues that I might have had, but not to the extent that I did with Sophia, because with Luca's arrival, I had 2 under 2. There was so much going on. And again, I think a lot of us, when you physically don't feel good, that's the first place you're going to go. And once you were able to quickly help me, the confidence boost was unbelievable. And then I really, at the same time, started my spiritual journey where I finally started seeing a therapist and doing breath work and seeing different spiritual guides and all these different things. But my friend, it started with you. So many people to start their journey with you because, a lot of my audience is the busy woman doing it all, which for a lot of us is the mom, also the career woman. And whether you're a mom or not, you may have things that are coming up. And certainly to your point, whether it's been trauma or just body change, just natural aging and the things that happen and the things that we need, you guys are there to help along the way on a regular basis or for a few months here and then a few months later. But I am just so glad you came on here because I hope you help other women and men find their way back to their bodies and feeling good again because you've done that for me and I could not be more grateful, my friend.
Thank you. Oh my gosh, my head's going to be so big. I won't be able to walk out of here.
I know. I'm about to see you too. I'm just going to be
so much.
The balloon. Yeah. Yeah. So, well, I appreciate it and everything that you do. As this is live, I am also going to be sending out an email to all of my subscribers with your information. So it's going to be your story and how people can connect with you directly so that after they listen to this, they're like, hell yeah, I need to contact Pillar. They will. So just so you know, that's going to be happening too. I do that for all my Wayfinders because to me, it's not enough to just have this episode, but I just really want to flood people with the information. So you'll be receiving that email too because I automatically make you a subscriber. So
there you go. That was number 1 subscriber to this.
Yep. Yeah. Yeah. So, all right, friend. Well, I know you have to get back to it. I have to go to my appointment with one of your PTs. So what a way to end this episode. I will literally see you and give you a hug in 5 minutes.
Yeah.
So
perfect.
All right, girly. Thank you so much.
Love you.
Love
You're the best.
you. Mwah. See you soon.
Bye.